Have you ever heard about diarrhea and constipation spiritual meaning and spiritual reasons? Well, they have spiritual, emotional, or metaphysical significance. Diarrhea increases how loose your stools are or how often you must go to the bathroom. It can be long-term or short-term, and each type has its causes and ways to treat it. Constipation is the most common digestive problem in the U.S. It is more common than any other long-term digestive problem. Also, about 900 people die every year from constipation-related or related diseases. Constipation and diarrhea can happen at the same time. Diarrhea cleanses the body from the inside out by removing poisons. What are you leaving behind? What can't you digest or understand? Your body is trying to cleanse itself of something nasty. Is there something you should ignore or say no to? Can you let clearing happen? How would it feel to rebuild oneself carefully? Let's interpret diarrhea and constipation spiritually. Spiritual meaning of diarrhea. In situations involving diarrhea, fear is frequently present. In some circumstances, it provides relief from what we cannot accept and digest and must continue to carry around. Every impression and encounter will leave you with something lovely and beneficial. Without hesitation, invite them inside and keep yourself open. A stress response frequently directly contributes to diarrhea and constipation. Commonly, diarrhea is connected to the fight-or-flight response, where the body expels digestive fluids to concentrate on the current task. Spiritual meaning of constipation. Constipation is an obvious physical indication of a psychological issue. It frequently involves manipulation and greed, particularly regarding material items. You can find it challenging to let go of outdated beliefs and to enable repressed concerns to surface. You are physically and mentally constipated and cannot let some things go. Stop avoiding what you find difficult to face by putting aside the past and your fears. You will discover the safety you seek if you freely let the flow of life pass through you. The freeze reaction is related to constipation. Two stress responses are fight or flight and run or freeze. Consider the animal that plays dead to elude a predator to understand how it can appear numb or despair. Although it may appear calm, the person is experiencing stress hormones in their blood. Although we don't generally think of depression as stress, it is. Emotional and metaphysical causes of diarrhea and constipation. The autonomic nervous system, a network of nerves connecting the brain to key organs, regulates most of your body's processes. The sympathetic nervous system, which equips your body for high-anxiety scenarios and fight-or-flight emergencies, is a component of the autonomic nervous system. In addition, the parasympathetic nervous system helps relax the body after a fight-or-flight response. 1. Gastrointestinal nervous system. With its abundance of neurons, the enteric nervous system is frequently referred to as a second brain. It converses with your brain and the rest of your nervous system using chemical and hormonal neurotransmitters. Most of the body's serotonin is produced in the enteric nervous system. By tightening the smooth muscles that facilitate the flow of food in your colon, serotonin aids in digestion. The brain may release hormones like cortisol, adrenaline, and serotonin during times of increased worry. Your gut's serotonin levels rise as a result, which results in stomach spasms. You can experience diarrhea if these spasms spread across your entire colon. Constipation may occur if the spasms are limited to a single section of the colon and stop digestion. 2. Stress component. Thanks to the neurons lining your digestive tract, your intestines contract and begin to digest your food as soon as you eat. This digestive process might bog down to a crawl when you're under stress. Constipation and stomach pain are two examples of symptoms that might develop chronic if your stress is severe or long-lasting. The gut-brain axis, which links your gut and brain, can induce diarrhea and other digestive issues that frequently go hand in hand with worry. The axis links your enteric nervous system, ENS, which serves as the neural system of your gut, to your central nervous system. Your GI tract's processes are regulated in part by the ENS. But because of its connection to your brain, It also impacts your emotions and behavior. Chemical messengers transmit information from your brain to your belly when you're upset. Sometimes these messages cause physical symptoms in your gut, such as constipation, nausea, or diarrhea. This connection is reciprocal. You may encounter psychological symptoms if you have gastrointestinal, GI, difficulties. Additionally, having IBS or other similar illnesses is associated with a higher chance of developing anxiety and other mood disorders. Spiritual healing for diarrhea and constipation. Meditation helps regulate the stomach because it lowers stress. There are various meditation techniques, but the one that seems most natural to you is the best. Constructive rest post is a fantastic place to practice meditation to calm the stomach. Your feet should be on the ground as you lay on the ground with your knees bent. Allow the feet to spread out so the knees can fall in unison. All the muscles in the belly are aided in relaxation by this. Breathe deeply while placing your hands on your tummy. Keep your attention on inhaling into your stomach. As far as you are able, try to unwind. Pay attention to what arises as you allow yourself to breathe into your stomach. Observe without passing judgment or attempting to alter anything. Pay attention to what your stomach is trying to say. You might find it helpful to put your experiences and any messages your stomach sends you in writing. Spend at least 5 minutes here, and attempt to do this every day for a while. This will help your body retrain its stress response. Do as your stomach asks and demands for a few days, and then check to see whether you feel any better. Preventive measures and treatment of constipation and diarrhea. Diarrhea prevention. You may take steps to avoid some of the causes of diarrhea, even if it may indicate an underlying medical condition and may not be preventable. For example, regular hand washing can help stop diarrhea after using the restroom, before preparing or eating food, before and after caring for an ill person, after touching rubbish, and after touching an animal, animal feed, or animal waste. If neither soap nor water is available, use 60% alcohol-based hand sanitizer. Getting children immunized against the rotavirus, which primarily affects infants and young children and causes severe diarrhea, is another crucial step in preventing diarrhea in children. Dehydration, fever, and vomiting are the side effects of the infection. According to the CDC, babies should receive their first dose of the rotavirus vaccine at 2 months old. At 4 months old, the second dose should be given, and at 6 months old, if necessary, the third. Treatment of diarrhea. Replace fluids. Clear broth soups, water, fruit juices, and sports drinks can replace electrolytes. Too much sugar might aggravate diarrhea symptoms. Eat bland foods. A bland diet might ease diarrhea symptoms. A bland diet includes mushy, unseasoned, low-fiber foods. Avoid raw, fried, alcoholic, and caffeinated drinks. Use OTC medicines. OTC drugs can minimize diarrhea pain. Imodium and Pepto-Bismol are alternatives to loperamide. Address root problems. Food allergies or digestive disorders can cause diarrhea. Through testing, your doctor will collaborate with you to identify the underlying problem and develop an effective treatment strategy. Constipation prevention. Even though constipation can be upsetting and uncomfortable, a variety of lifestyle modifications, such as dietary adjustments, exercise routines, and even changing up specific supplements, can stop it before it even starts. Regular exercise. Everything continues to move as long as you move. Increase your consumption of dietary fiber. Consider including high-fiber foods in your normal diet and plenty of water. Pay attention to your body's cues. If you must relieve yourself, do so immediately. Additionally, don't push yourself too hard or hasten the process. Relax by adding a little zen to your bathroom regimen. Treatment of constipation. Your doctor might advise a fiber supplement, stool softeners, or other medicine, either over-the-counter or prescription, to loosen things up again if lifestyle modifications aren't working. Laxatives are one option, but using them under your doctor's supervision is preferable because using them frequently can make it difficult to have a bowel movement on your own. Constipation can be treated using prescription drugs. final word. Understanding the problem's spiritual and physical origins is the first step in healing gastrointestinal disorders. We may not realize digestive difficulties start before food enters the stomach. When we think about specific foods, our digestive systems react. Anything tasty can make us drool. Delicious meals can also trigger reactions. Lemons can stimulate salivary glands. Seeing food we hate may make us sick. What's put in must come out, feeling constipated. Constipation can include bloating, pain after eating, chronic abdominal pain or cramps, foul-smelling gas, irritability, exhaustion, or cognitive fog. Inability to pass, gas, rectal bleeding, hunger changes, vomiting, or difficult bowel motions are further symptoms.
If this video resonated with you, don't forget to hit that subscribe button, give it a thumbs up, and tap that notification bell. Stay tuned for more enlightening content coming your way. Thanks a bunch for joining us on this journey.